طلعنا من الليكتشر، طلعونا ودخلنا التاني. اوكي بصوا عشان نتفق على السيستم اللي هنمشي عليه. الليكتشر طويله، اوكي، هنتكلم فيها في كذا سبجكت، كل موضوع هنتكلم فيه هي زي اجزاء. انا كل شويه هتشك مع الناس اللي معانا، لو كله تمام هنكمل، لو الناس تعبت هنوقف، هنشوف هنمشي ازاي. فانا هبقى معاكم دايما بتشك معاكم. بعد ما نخلص الليكتشر هناخد اسئله. يا ريت نقفل المايك كل الناس بس عشان الدنيا تمشي مظبوطه. بعد ما نخلص الليكتشر هاخد اسئله على الشات، اللي عايز هيكتب السؤال بتاعه على الشات وهنجاوب عليه، او ممكن يتكلم في المايك وهجاوبه عليه.
دكتور could you
بالنسبه
speak
للناس
English please?
اوكي طيب for people حاضر. انا لسه still in my introduction is for my just to say and we will start the lecture now. Please close all your mics, turn it off, nobody speaking in mic, and after we finish the lecture we will speak on chat to take the question or start to speak in mic to tell me your question. So please don't disturb during the lecture. The lecture is many parts. We will start with the first part, second part, third part. Every time I will check with you all. If you all accept it, we will go to the next part. For people they know me or they don't know me, we will speak. And I don't like to speak in my lecture, especially online, on Congress, on big debate. I like debate. I like to speak in something we agree and disagree, something new, something is new technique, new vision, how to do, and we speak together. خليني صريح معاكم, it's very easy في ال cosmetic dentistry أو في ال aesthetic dentistry أنك to know how to apply something. You know how to do composite veneer, how to do porcelain veneer, how to do filling in aesthetic way. This is very easy. But اللي أنا دايما بشوفه and most difficult how to apply what you learned in one case. Like if you have one case, okay, should you do veneer, composite, you do porcelain, so you don't know. I do crowns, what I have to do. This is the most difficult. How to apply the skills you learn in one case. فدايما الليكتشر بتاعتي انا بحب يكون فيها good vision, good debate. كالعاده يعني الناس اللي حضروا معايا قبل كده or people they attend my lecture, most of them they will accept or not accept, but at the end we will be all of us have a new education level. اوكي الليكتشر بتاعتنا النهارده هتكون less is more. Less is more is a new concept. I like to talk about it. I will explain step by step when we go to through the lecture. انا بحب الليكتشر بتاعتي دايما تكون like a story, and I telling you some story to be interesting for everyone to listen, وتبقوا attractive معايا وinteracting انكم تسمعوا القصه كلها ماشيه ازاي. Less is more is one of the Vinci concepts. The Vinci concept developed by me. الغرض منه ان احنا نقدم philosophy جديده. الفلسفي دي لما انا اتكلم عليها now هنتكلم عليها step by step. You will see this philosophy موجوده في كل aesthetic clinic and you face it every day in your clinic. طيب قبل ما ابدا انا عايز اتكلم على something is very wrong, something mistake عندنا في الميدل ايست. عندنا في الميدل ايست دايما في confusion بين الكوزماتيك وبين الاستاتيك. اوكي انت في عيادات الاستاتيك دنسري او التجميل we do only two kind of treatment option. اوكي these two kind of treatment option is different. في فرق كبير بين الكوزماتيك دنسري وفي فرق بين الاستاتيك دنسري. And to be honest, this is the only option we do in our aesthetic treatment. I will start to explain عشان مش عايزكم تتلخبطوا, لان دايما الناس بتتكلم على الكوزماتيك دنسري وعلى الاستاتيك دنسري انهم حاجه واحده, مع ان في huge difference between الكوزماتيك دنسري وبين الاستاتيك دنسري. Maybe all of you doing cosmetic dentistry, but aesthetic dentistry is different and you up level of education. في فرق بينهم. خليني اشرح لك بالراحه. الكوزماتيك دنتري in some way like you have some tooth and individual tooth. والindividual tooth فيها problem. البروبلم دي could be problem في الشيد, problem في الشيب, fracture tooth, whatever you do, filling, you do veneer, you do crown, whatever you do. All what you're doing now is you're trying to return the tooth to the natural looking. بمعنى آخر you have tooth, التوث فيها problem, عملت التريتمنت بتاعك فرجعت التوث تاني to be natural او ترجع زي ما كانت قبل كده قبل ما يحصل فيها الدامج اللي هو الفراكشر او ستيننج او بلا 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 whatever. اوكي فالكوزماتيك دنتري يعني تعمل good crown, you do good crown, you do good veneer, you do good composite. This is cosmetic dentistry like the case we have here. هنا عندنا الكيس في عندها مشكله في السنترال انسايزر, عندنا مشكله في الكراون. اوكي البروبلم اللي في الكراون هنا اول ما تشوفوا everyone if in me اول حاجه فكرنا فيها البروبلم in shade. The shade is not matching. في ستيب مهمه جدا في الاستاتيك دنتري, it's not our topic today but I have to say يعني في حاجه اسمها psychology of success. It's many steps في الاستاتيك دنتري, بس اول خطوه في السايكولوجي اوف سكسس في الاستاتيك دنتري بتاعتنا اللي هي ايه؟ to listen to the patient. You have to listen to the patient complain, لان البيشنت complain هي دي اللي على اساسها انا هقدر احدد التريتمنت بلان بتاعي. اوكي هنا عندنا اول حاجه هنشوفها لو انا I don't listen to the patient, المشكله عندي هتكون ايه؟ هتكون الكراون, ان الشيد مش حلو, الشيد مش واضح, الشيد فيه different shade. فانا اول حاجه لو انا don't listen to the patient هشيل الكراون, remove the crown and add new crown with the same shade. طيب لكن لما انا هنا بدات اسمع للبيشنت, البيشنت بدا to complain from the crown, البيشنت complaining from the crown that the crown is not my teeth, this is not my teeth before. هنا البيشنت كان كل الكومبلين بتاعه ان الكراون is not resembling the natural tooth he has before. طيب اوكي ده كويس قوي. كل الكومبلين بتاعت البيشنت he didn't mention the color. كل المنشن بتاعه على المشكله ان الكراون doesn't resemble the tooth before. طيب الله, يبقى هنا البيشنت اصلا عنده مشكله ثانيه غير الشيد, هو مش شايف الشيد, فهو عشان كده السايكولوجي سكسس you have to listen. هنا يبقى انت لازم to ask the patient I need to see photo or picture for your teeth before you have the crown. صح؟ هنا اتس ايزي دلوقتي في الايرا اللي احنا فيها ان هو هيفتح لك فيسبوك, انستجرام, اي حاجه, هتشوف الصوره هتلاقي الصوره بتاعت التوث بتاعته قبل ما يحصل فيها الكراون او before we doing the crown. هنشوف الصوره. When we see the picture هنكتشف ان البيشنت كان عنده التوث angulated a little bit. It's not was السنه ما كانتش good alignment, وهو عايز to return the tooth to the natural زي ما كانت بالظبط. هو ده الكوزماتيك دنتري. الكوزماتيك دنتري in different way you treat one tooth, individual tooth or two teeth or quadrant to return it back to the natural اللي كانت عليها. ده الكوزماتيك دنتري. يبقى في الكوزماتيك دنتري هنا نترجمه بصيغه ثانيه you don't need to have vision or idea. انت مش محتاج يكون as a dentist عندي design vision idea خالص. انا كل اللي انا محتاجه skills and knowledge. skills ان انا عندي skills to do whatever crown, veneer, composite, blah blah blah. knowledge ان انا عندي knowledge اللي هو before photo and I can do that after photo to be resemble mirror image from each other. ده الكوزماتيك دنتري. اوكي فالكوزماتيك دنتري مش محتاج زي ما انا قلت لك, لا محتاج منك فيجن ولا ديزاين ولا ايديا, محتاج منك سكيلز. كوزماتيك دنتري زي ما انت تيجي تعمل بشوف ناس كتيره عامل filling plus 4 composite very nice. اوكي ده مش static, static dentistry. It's not an static dentistry. This is cosmetic dentistry. Okay, my friend, you did cosmetic dentistry and you did it very well. But cosmetic dentistry لأنك you treat one individual tooth or two individual tooth وكان ال purpose of treatment to return to the natural. يبقى هنا أنت ما فيش vision أو idea, ما فيش حاجة, أنت just doing good skill. Okay, فعشان كده ال cosmetic dentistry in different way it's like copy and paste. You copy the antagonist and you paste it. This is cosmetic dentistry. It's what I call cosmetic dentistry. There is no vision. There is no idea in the treatment. It's always a skill. You take this photo, the picture to the tooth before, and you copy here. The same shape, same size, everything. Okay, this is cosmetic dentistry. But if we go to smile makeover or aesthetic dentistry, is different story. For aesthetic dentistry, what we do, aesthetic dentistry we have a case and the case دي completely malformed smile. It's completely malformed smile. هنا بقى you need idea and vision. طب ليه? Why I need idea and vision? You need idea and vision لأن هنا you don't have one individual or two individual or three teeth malformed and you try to return to the nature. This is the nature of the patient. You don't have before picture. This is the before picture. Like in the cosmetic dentistry, you have before picture and something damaged in the before picture and you try to develop after picture. But في aesthetic dentistry, this is the before picture. أنا ما ينفعش أقول للبيشنت give me طب وريني أنت وصلت كده إزاي. I need to see picture before to return your smile. No, this is my smile already all my life. I need to change it. فالaesthetic dentistry is different. You need idea, you need vision, you need design. أنت عندك البيشنت جاي بmalformed smile. You need to do all your idea والvision بتاعتك انك how to develop السمايل دي to move it to the new smile. هنا بقى الاستاتيك dentistry this is an aesthetic dentistry. aesthetic dentistry بيتكلم على ايه؟ aesthetic dentistry بيتكلم على انك تستخدم الفيجن، تستخدم idea، تستخدم smile makeover plus your skills in crown, veneer, perio, implant, blah blah blah. Even sometimes you use another specialty بيجوا يشتغلوا معاك. Specialty could be surgery, perio, blah blah blah. To develop the case to go with the case to the better quality, the after picture. But you don't have before picture. You have only here after picture. الديزاين اللي انت عملته. ده فرق كبير قوي بين الكوزماتيك دنسري وبين الاستاتيك دنسري. بمعنى اخر احنا قلنا الكوزماتيك دنسري انك يكوبي، يعني عندك دامج توث and you copy من صوره before قبل كده و I return it back again. This is copy and paste. This is cosmetic dentistry. لكن في الاستاتيك dentistry you have bad smile and you try to improve this smile to go to better smile. Okay, so you do design. Okay, you need vision, you need idea. And aesthetic dentistry اصعب من الكوزماتيك dentistry to be honest. ليه؟ لأن في الكوزماتيك dentistry all you need is only skills. You have good skills, you can do that with. لكن في الاesthetic dentistry skills is not enough. Okay, you have a good skills, but you return a smile. How are you gonna return the smile? You will do all teeth crown, you will do veneer, you need to do perio. This is the vision, the idea, how I return the smile back to good smile. Okay, فده التو اوبشن اوف تريتمنت اللي عندنا في الاستاتيك فيلد كله عباره عن to do cosmetic copy او I do smile makeover. I do design for the cases aesthetic dentistry. Okay, are we good until now? Anybody write in chat anything? اكتب لي في الشات اي حاجه. Are we good? ماشيين كويس؟ اوكي. ده كان شغالين كده. This was for many years. We go كل البيشنت اللي بيجوا لنا يا اما patient cosmetic كان بياكل have a broken teeth had a problem في مشكله something is going wrong and we want to do some treatment to this tooth. وكان عندنا حالات aesthetic dentistry. People come with a smile which is badly malformed smile and they want to go with nice smile. ودي كانت حالات الاستاتيك وده كان اللي احنا شغالين فيه all our field والeducation بتاعنا واللي بنشتغل عليه. بنتعلم composite veneer بلا بلا بلا، بنتعلم smile design عشان حالات الاستاتيك وده اللي كان الكونسبت for many years. بعد كده بدأ alarm يبدأ يعمل تيت alarm in my clinic or in different clinic even in your clinic. لو انا لما ابدا اتكلم الستوري هتبداوا تفهموها. بدا يحصل الارم جديد ان البيشنت start to change. بدا يتغير الليفل اوف patient coming to our aesthetic clinic. بدا يظهر new type of patient. خلاص هبدا معاك القصه step by step الستوري وهحكيها لك كانها happen in my clinic and you will listen and we will see and you will accept this is happening today. Okay, the story starts like this. When one of patients come to your clinic, the patient come, I always like to say it's client actually, not patient, because most of aesthetic treatment, they come in client because they don't have any problem. They don't have pain, no pain at all. they have malformed smile or they have bad smile, and this is not pain, it's not medical advice, so it's not, they are not patient, they are client. They are client like they going to hairdressing designer, whatever. So I like to call it client. So client is coming and say, I don't like my smile. You as a dentist, me, I'm always say, okay, let's design you an attractive smile. My client said, amazing, doctor. Could you please explain to me the procedure, how you will improve my smile? Me, okay, no problem, for sure. Then I take photo to the patient, impression, blah, blah, blah. Patient go home. I spend all my night doing a smile design, digital smile design, or it depends everyone. Some people do digital smile design. Some people like me, I prefer to doing in wax. Okay, some people do printing, whatever. All is the same at the end of the situation. You do design. So I spend all the night to doing design. The problem when I do design for case for aesthetic, minimum you do 8 veneers. There is concept, I believe in it, to do 8 veneer or 4 veneer. I don't do 6 veneer. I don't like 6 veneer. Why? Because when you do 6 veneer, always the canine is look like vampire canine, because the canine will be, the veneer over the canine will be protruded and alignment, and you will have the 2 premolar is going lingually because nothing, you didn't move, you didn't put anything over the premolar. So it's better to take always 8 veneer or 4 veneer, but don't go for 6 veneer, okay? So I did my design for 8 veneer for the case. I did everything good. I respect my line. I'm respecting the gum. I doing gingivectomy. I respected proportional of teeth. Everything is nice. I did my red proportional. I'm so happy with the design. Next day, the patient is coming. I start to explain with him everything. And I told him, okay, we will do 8 veneer. I'm going to do minimum prep veneer, as I'm going to remove 0.3 millimeter to 0.5 millimeter from your buccal side of tooth. And some teeth will need to do a little bit gingivectomy. We'll do it by laser. And later on, I may need to do some filling in 1 or 2 teeth before I do this treatment, blah, 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 and explain everything to the patient. I'm so happy as a dentist because I did good with smile design. I'm so confident. And this is my patient say. 90% of patients will say no. It's painful, permanent, damage, gross, nubs. Sorry, I go back again. I'm sorry. Sorry, we need to go back. Okay, this is the answer of my patient. 90% of the client will say, no, it's painful, it's permanent, damage, dross, nubs. If you see here, they refuse the treatment. Yes, I'm so disappointed now. I did my job, I did everything right, I did what I learned. I spent all night doing the design. I was so exciting for the case. I'm sure I have a good design. And next day, I'm disappointed. My patient come and say, no, it's painful. You will grind my teeth. I don't like to grind my teeth. Something, because of 2 things. Maybe because he knows someone grind his teeth and some problem happened, حصل مشاكل قبل كده, عنده bad experience, whatever, but most of them they said it's painful. I don't like to grind my teeth. Your treatment is permanent. What happened if one of my veneer, I lost one of my veneers? Of course, if them said you have to put another one. ده بالنسبة له it's permanent treatment. Damage, the patient thinking you will damage my teeth, okay? Gross, no, it's too much work and it's very bad work. Nubs, I don't want to do this. ده كان disappointment ليا كبير قوي, لان انا ده كان وصل ان الرقم بقى عندي في الكلينيك 90% of cases هم بداوا يقولوا نو للكيسز بتاعتي. طيب هنا خدني النقطه ثانيه ان انا I was trying to find the clue. الله, المشكله فين? Where is the problem? I do my job very well. I did my study case, I did my design, my idea, my vision, I did everything I could. Like, why my patient is always saying, no, I don't like this treatment. هنا بدأت to search for the clue. طب where is the problem? المشكلة فين؟ لما بدأنا ندور على الكلو اكتشفنا أول حاجة يعني most of patients coming to do aesthetic treatment. Nowadays, it's 90% of clients nowadays in your clinic, they come with good smile. Actually, they come with good smile and they want to move their smile from good to better. يعني هم السمايل بتاعتهم ايه؟ Good smile. يعني the patient is coming with very good smile. It's not bad smile. It's not malformed smile. لا, the good smile. طيب, as long as the smile is good, the patient refuses to do work أو grinding في التيث. لأن أنا actually بالنسبة للclient, my teeth is looking nice. I'm just trying to have it more nice. يعني moving from good smile to attractive smile. So I don't need to, if I'm gonna do grinding in my teeth, you will gonna do too much work in my teeth. No thanks. I don't wanna do this. This is enough for me. Okay? فإحنا هنا هتقابلنا مشكلة أن 90% of cases لو بدأت أعمل searching ليه saying no, why 90% of my clients saying to my treatment no, اكتشفت أول حاجة أني 90% of the cases they have a good smile and they want to move the smile from good to better. So معنى كده أن good smile, so they don't want me to touch the smile, and this is true. I don't have to touch the smile. تاني حاجة, I start to look for my treatment option as a dentist. أول حاجة في treatment option عندي الكراون. Okay, when I start to look to our treatment option crown, it looks very invasive actually. We remove too much of the tooth. تاني treatment option عندي كان الفينير. Okay, it's non-invasive. It's good. I just remove 0.3. And why my patient saying no? When I start to look to the natural teeth and I put my natural teeth side by side with minimum prep veneer, okay, no. I found something. This is not veneer here, is not reversible treatment. Okay, it's a reversible treatment. And if you look to the veneer and you look to the natural teeth, the difference of prep here, yeah, to be honest, this is a reversible treatment. This is somehow invasive, and patient will not like this anymore, especially if the patient is like to want to move the smile from good to better. Okay, يعني معنى آخر, if the patient have a good smile, they don't want to move the smile, they will not allow you to grind the teeth. اللي قدرنا نوصل له في الكلو وصلت له أني most of patient they like to have less workload and they want to have less preparation type. Less workload by meaning definition, let me explain. وصلت أني most of patient they want less workload. They don't want me to do like 8 veneer, don't do many teeth. They want to do 1 or 2 teeth to correct the whole smile. They don't want me to grind many teeth. They don't want to come many visits to my clinic. They are, as I said, client. They coming to improve good smile, not bad smile. Good smile to excellent smile. Okay? And they want, even if I'm gonna do workload in one tooth, they want that workload in one tooth to be less preparation. That means if you can do prepless veneer, it's better. If you have to grind, so do minimum prep veneer. They will not allow me, even if I'm gonna do one tooth to correct the smile, to do too much preparation. Okay? طيب يبقى تاني, let's conclusion is searching for clue. For searching for clue, أنا اكتشفت why people saying to my treatment no. Why many people come to my clinic and say no, I don't want to do this treatment. أول حاجة وصلنا لها أني first, and most of these patients, they come with good smile. And this is new for aesthetic treatment, to be honest. احنا كaesthetic treatment or aesthetic dentist, we always use, and most of the patients come to our clinic, they come with excellent. They come with very bad smile and they want to improve the smile. But nowadays, 90% of clients come to our clinic, they have a very good smile and they want to move the smile from good to better. So they don't allow you to do too much work in the teeth. تاني حاجة اكتشفنا and there is big difference between prepless and between prep veneer. Okay, anyhow, if you touch the tooth, it's big difference. It's irreversible treatment, and most people will appreciate more reversible treatment. So this is what I found. Then I moved to mind reading, to read the patient mind, to put all these steps in my mind and thinking what these people want. And I found that Most clients will appreciate 90 to 80% result over 100% result, as long as there is no preparation or grinding of teeth and treatment is reversible. Let's say it again. Most of people, if you told the patient, okay, I can make your teeth 100% excellent, but I have to do minimum prep veneer for 8 veneers, okay? This is our first option. My second option for you, I can give you 80% excellent smile or 90% excellent smile, but I will not grind any teeth and I'm gonna do prepless veneer or whatever, any non-invasive treatment. Give you 1 second, 2 seconds thinking. What do you think? Patient will choose number 1 or number 2? Choose 100% result with grinding his teeth, or choose number 2 and 80% result, 90% result without grinding the teeth? Think what they're gonna choose. Of course, patient will choose choice number 2. Why? Because the patient, as I said, come with good smile. The smile is already good, and he wants to move to more better smile. So he wants the treatment to be reversible. That means anytime I want to change my smile again, I can remove whatever you did, dentist. Second thing, I don't like to damage my teeth or feeling any pain. So احنا وصلنا أنا للconcept ده. And most of people would like to have 90 to 80 results over 100 results as long as you are reversible treatment. فالconcept ده in translation اسمه less is more. As less work you do, more appreciation of patient is coming to you. Okay, more repair, more appreciation. Hena, I have to tell you something, guys. We don't speak about the money. Okay, in aesthetic treatment, people know dentist is expensive, and even they know aesthetic dentistry is more expensive than the normal dentist. So any client coming to your clinic, he knows that he's gonna pay money. So I don't say less is more. I mean by money. No. Take the money out of the equation. We speak about less work. Less work you do in the teeth, more yes from the patient. More acceptance, more appreciation, more repair. Are you accept with me until now or not? Okay. Okay, so the result اللي احنا وصلنا لها زي ما انا قلت اني less is more. As much as we do less work, we will gain more, yes, more acceptance, more repair, more appreciation of our patients. Even if you go for a smile like this smile, the patient is, okay, smile is malformed, to be honest. You see this smile? Guys, الصوت تمام? The voice is good or not? I need to know. Do you hear me good? Okay, good. Okay.
يا عم بدك لو فاضي.
Okay, let's go. Let's look to this picture. Even with this patient, the teeth is malformed, right? You have malformed smile. They don't like that smile. The patient, even me, I don't like the smile. Even with this patient, I gave him 2 options. 100% option, 100% result. I told him I will do design, minimum prep veneer, and I remove just 0.3 millimeter from your teeth. Then you will have 100% excellent line, excellent smile. You know what my patient said? No, the same. I got the same answer again. No, it's permanent. What am I going to do is damage to my teeth, gross naps. I don't want to do. I told the patient, okay, it's permanent, but listen to me, my friend. Your teeth is looking very bad. So when I do my treatment, okay, it's permanent and non-reversible, but all of the mean is going to be 100% better than your smile. The patient answered me again, no, it's non-reversible and damage to my teeth. I told him, okay, whatever. Even if I damage your teeth, but I give you 100 to smile, why you go back? You want to go back to your smile? Why you don't need reversible smile? He said to me, I don't like to damage my teeth. I am 25 years old. I want to let my teeth live with me more. Maybe later on when I was 40 or something, I decide to do some kind of grinding of my teeth and having more permanent. So even with this smile, with this bad smile, I told you 90% of clients will say, no, I don't like to do any grinding of teeth. So we give this patient less is more. We give him 80% smile. We told him, okay, I can give you 80% smile. This 80% smile giving to you, and I will not touch any of your teeth. I'm going to do you something reversible. You can have it. You can, if it's anything happen, you can remove it back, and you can have your teeth and your smile the same. And the patient said, okay, I want to do it. Okay, so we did veneers reversible. 80% result, and the patient accept. Okay, this is what I'm telling you. Nowadays, people is moving, it's changing. The client for aesthetic dentistry is changing. Most of patients nowadays, they don't want to do any kind of grinding of teeth. Most of them will appreciate 80% result, 90% result, over 100% result, as long as you didn't grind or move from teeth. Even like, if the smile like this patient before, the smile is not good, he accepts to be with the bad smile than to grind any of his teeth, okay? So this is take us to the concept. The concepts take us 10 years to develop, to thinking as a minimum, as a cosmetic dentistry. And for people attending my lecture before or attending one of my courses, they know that Da Vinci concept we have many concepts for starting from diagnosis of the case, smile evaluation, smile analysis, even a smile design, how to solve many cases. The concept, the shade concept, how to select a shade and Da Vinci concept. We have many concepts, and all is simplified to be applied in any clinic. Our concept is simplified to be done in any clinic. You don't need special equipment. You don't need to have fancy to buy anything, just to do it in any clinic everywhere. Of course, today is not our topic to speak about all the Da Vinci concept, because it takes like maybe 5 days to speak about all the Da Vinci concept. But today I will give you some flavor of Da Vinci concept because it's related to our topic today, less is more. And in the concept we find this. We always learned to do smile design for every aesthetic case. صح؟ كلنا اتعلمنا انك انت لما تيجي تعمل اي كيس we have to do smile design. اي case patient want to do smile makeover, you do digital smile design, white fab, you do printing, whatever you do. كلنا بنعمل smile design. Okay. You start to take impression, take photo, and you start your design for the patient, right? Okay. احنا اكتشفنا بعد كده انك انت smile design is not the important thing. Okay, لأن بعد ما بنعمل smile design, any smile design, to be honest, any smile design you do it in all your life based on grinding on teeth. ما ينفعش تعمل smile design without planning to grind the teeth. Most of the smile design is based on or build up on grinding of the teeth. And هنرجع تاني لما أبدأ بالsmile design, I will have the same problem with the patient. 90% of clients will say, no, you will grind my teeth. اللي وصلنا له ان السمايل ايفالويشن اتس مور امبورتنت 100% عن السمايل ديزاين. ليه السمايل ايفالويشن؟ because في السمايل ايفالويشن انت بتقدر تيفالويت ذا سمايل. لما بتعمل ايفالويت ذا سمايل بتقدر تكاتش الميس دايجنوزس، بتقدر تعرف الميس مالفورمد توث، بتقدر تعرف البروبلم فين في السمايل، بتقدر تحط ايدك على النقطه الغلط. Which point is wrong? Which point is defective in the smile? The point is defective في السمايل دي. If you can correct it alone, you will correct the smile. You will have 80% to 90% smile. صح؟ لأن دايما في أي smile في something wrong, something في problem. Okay? فالسمايل evaluation اكتشفنا أنه it's very important and very important to learn smile evaluation احسن من السمايل ديزاين because nowadays people we serve they like more to have more prepless or less is more. عشان كده في الدافنشي concept we always learn people to use static eye. We learn and train your eye to be a static eye. هنا أنا I'm always saying static eye مش معناه إن عينك is very nice eye so you can see everything is nice. No. Static eyes معناها أن your eye can catch the problem. When you look to any smile, very quickly you catch where is the problem فين, how to deal with it, how to correct the defect. This is the static eye we're trying to learning to you. ليه بعلمك دايما وبركز على الstatic eye you have to learn؟ لأن أي smile, if you look to any smile you look, and you have line. In the midline you have, this is the midline, okay? Dental midline. For any smile, we have the dental midline, we have right and left side, right? The right side and left side around the midline should be mirror image. المفروض يكونوا الاثنين resemble. Both is the same. The right side, the same like left side. الاثنين يكونوا twin mirror image. لو الاثنين mirror image and twin, that means your eye cannot catch any defect. مش هتقدر تشوف أي defect في السمايل. السمايل هتبقى بالضبط in harmony. Right and left side is the same. This is mean harmony. لكن if we go عشان توصل للتريننج بتاعك، لو عايز تعمل تريننج للstatic eye how to detect very quickly the problem، أحسن حاجة تستخدم two pictures to catch the difference between the two pictures. This is the best option to treat your eye. This is the best option to treat your eye, how to treat your eye to be good evaluation when you look to any smile. Why? Then it's the same. When we look to the smile, we have the midline, we have picture on right, picture on left. You have to catch the difference between the two pictures. If you see here, I have here diastema. عندي هنا problem في الcrown. And next side I don't have diastema. The problem هنا في الcrown. So if I correct, make it's perfect. Why? Because I correct. So I have the picture in the right side midline and left side of the midline, the both of them is in harmony, right? طيب, and I like to speak in this case very quickly. Okay, if we look here, this we have a crown, right? The problem in crown here الshade. طبعا تاني حاجة البروبلم proportional of this crown is bigger than the other central. Okay, we accept, and we have diastema here between lateral and central. احنا قلنا عشان to detect any problem we draw line in the midline. المفروض right side and left side to be mirror image together. Okay, هنا even في كل الكيسز زي ما انا اتكلمت احنا بنطبق فيها الكونسيبت بتاع less is more. Okay, less is more يعني معناها less workload and less actually preparation, both of them to go non-invasive at all. I want you to learn how to go non-invasive at all. هنا كان patient we give him two options of treatment. First option of treatment, which is non-invasive at all. I will remove this crown and I put another crown. The crown is resemble these tooth. When I put another crown, if the proportion of these is equal to proportion of this tooth, هيبقى عندي هنا ايه؟ واحد اثنين the same diastema right and left. This is totally non-invasive. Okay. كلكم هتسألوا how this is totally non-invasive. I will tell you. هنا أنا عملت إيه؟ I didn't use hand piece. أنا ما مسكتش الهاند بيس. كل اللي أنا عملته إن أنا evaluate the problem very good and the good smile analysis and between right side and left side of midline. والديتكت بتاعي كان إني عندي مشكلة في الدايسما في الكراون. Okay. I didn't use my hand piece. The decision I removing this crown. هشيله إزاي؟ crown removal. Okay. You remove the crown. Take compression, make a second crown, good in shade and proportional, صح؟ دي first option of treatment. Nowadays, I give you 80% of smile. This is 80% smile. Okay, it's not 100% of smile. This is 80% smile. ال 80% smile دي patient خدها with less workload and no preparation at all, non-invasive. So patient accepted treatment. Okay, I give him second option. Okay, I told him later on, if you want to move to 100 smile, I can do you 2 veneer on the lateral to close the diastema. Here and here. I do 2 veneer, minimum prep veneer. If you like to do 100 smile. To be honest, this patient actually, they accepted 80% of smile and said, it's very nice to me and this is fine. I don't want to do anything more. But still, he had the option. If he wants to move to 100 smile, I can move without changing anything. Just I'm going to do 2 veneers here. Okay. So the treatment. What is the treatment in listen more? يعني بمعنى آخر, ايه option of the treatment we can use it in the concept listen more. This is the option of the treatment we have in listen more. A procedure in non-invasive era. Okay. أول حاجة طبعا prepless veneer, 8-12 teeth in upper arch, prepless veneer for the lower arch, partial porcelain pieces to replace class 5 fracture, and prepless veneer in combination with ceramic substructure to match adjacent teeth. This is the most common used. We use it for treatment non-invasive era or treatment for less non-invasive procedure to get more appreciation, get more yes from the patient. Okay, I will speak على prepless veneer till end of the lecture. I will speak. I'll give you some speak about the prepless veneer and how we do it. Okay. But now I want to focus على partial porcelain pieces to replace class 5 fracture with prepless veneer in combination with ceramic substructure. Partial porcelain pieces to replace class 5. Okay, the problem always in class 5, sorry, not class 5, class 4, I'm sorry, guys. Okay, guys, how are we doing until now? It's good? Everyone is following me? Okay, listen guys, I have to say something. For people, they are fresh graduate or they don't have good clinical experience in aesthetic, this lecture will be very difficult for them, to be honest. For people, they doing excellent or they start doing aesthetic, they have some knowledge about aesthetic treatment, the lecture will be good for them and it will be advanced level of education and advanced treatment, advanced tricks. But for people, they are fresh graduates. I'm sorry, guys, it will be somehow difficult because this is advanced speaking about aesthetic dentistry. Okay. Right. Class 4. Class 4 is always difficult. Even this fracture. If I'm trying to do it in composite, I can do in composite. But put in your mind that this is area of biting, too much force. So maybe after a while, it will be broken again. Second problem, this area of biting and fooding and drinking and smoking and everything goes through this area. So what happened in this area after time for composite, it will be stained. Okay. So my best way to do this, to take an impression, I don't do anything, just take an impression. I don't do anything on the tooth. Just we take an impression. Then we make ceramic wax up on model. Then we make ceramic piece to be cemented in this area, as you see. Okay. Okay, this is challenging. Challenging in 2 ways, to be honest. This treatment's come kind of challenging. Challenging is need you to have good shade selection. This is one challenge. Second challenge, to do good wax up to the piece, fracture piece. Third, to have a good lab and put many line under good lab. I'm sorry, you have to put many line. Why? Okay, I tell you something. There is something called micro aesthetic. Micro aesthetic is the aesthetic that depend on to have on lab technician. There is something called micro aesthetic. Micro aesthetic depend on lab, and you have macro aesthetic. Macro aesthetic depend on dentist. So to have good treatment in aesthetic dentistry, it's 50-50%. You have 50% depend on the macro aesthetic on the dentist, and 50% depend on the macro aesthetic on the lab. So sometimes you have very good dentist and very bad lab. So the work is looking, yes, very bad because the equation is wrong. Sometimes you have very good lab and very bad dentist. So even the work is looking like 50%. Why? Because you lose the 50% of dentist. So in aesthetic dentistry, we work like team, dentist and technician. Okay. Okay, guys. This is, as I said, for fresh graduates, it's going to be somehow difficult. For dentists to do aesthetic, it's going to be interesting. It's advanced and level up. This patient comes to us. This patient, the problem, they have a good smile actually. What do you think? Look good. Okay, look good smile. It's not bad. Okay, it's not bad smile at all. It's look good. As I said, 90% of cases come to my clinic with good smile. It's not bad smile, and they want to have better smile, right? Okay. Now this is patient come with good smile. If you see in this circle, they have 2 crowns. To be honest, the shade is good, and everything is it's not so bad. It's looking good, and this is 2 crown, and the patient want to improve the smile. Okay, let's have 5 seconds silent, and I need everyone to think in his mind what we have to do. What's your treatment plan, my dear dentist? 5 seconds, start to think. Okay, my first plan was, of course, to change this crown with another 2 crowns and do veneers on central and lateral. Here, I remove this crown. Then I'm going to do veneer here and here. Okay. And I told my lab. My lab answered me that, okay, doctor, you know that it's very difficult to match crown to veneer and color. Why? Because veneer, the thin is 0.3 millimeter to 0.5. Crown thickness of porcelain is going to be 2 millimeter, right? Right. So they will be different in opacity and color between veneer and crowns. So it's very difficult to match the colors. That's right, because when you decrease the thickness of any material, the opacity and translucence of the material is changed, so the color will be changed again. So it's very difficult to match both of them. So he told me, no, it's very difficult to do this. So the second option is my mind to do 4 crowns. Okay, so let's do 4 crowns. So like change these 2 crowns, then I do another 2 crowns. And to be honest, of course, when I was thinking that, I'm thinking that my patients sitting in front of me, قاعد قدامي, وانا بقول له I will do 4 crowns. Of course, he will say ايه؟ طبعا no. Why he will say no? لأن patient already will tell you that. Listen, dentist, I already have 2 crowns, and I have psychological trauma, and I have bad experience grinding my teeth, and I have 2 artificial teeth. And even after 4 to 5 years, I didn't like the new artificial teeth the dentist before you done for me. So I'm coming to you to change these 2 crowns and have a good smile. If you grind the other 2 teeth, I know that after 4 to 5 years, I have to go to another dentist to change again the artificial teeth and have good crown. فأنا عارف أن الرد هيكون إيه؟ No. طيب. بدأنا نفكر في situation how to solve this situation. ازاي to go very non-invasive, how to make the patient say yes. Okay, this technique is called ceramic substructure. Ceramic substructure is not my technique or developed by me. It's developed by many people. One of the best one speak about it was Dr. Dennis from United States. This is the first one to speak about this. Whole the idea is we know that we can cement porcelain over porcelain. Again, we can cement porcelain over porcelain. That means if I have piece of porcelain and another piece of porcelain, I can use cementation to cement this porcelain together as long as this porcelain can be etched. Okay, again, the technique is built up is if I have porcelain and another piece of porcelain, I can cement 2 pieces of porcelain together with cement, veneer cement, as long as I have etch porcelain. I can etch this porcelain. Okay. So the plan was like this. Oops, sorry guys. Okay, this is the 2 crown. It's up here. I'm going to remove the 2 crown. Guys, I need you to count with me if I'm going to use my hand piece and I will be invasive or not. Okay, let's start. I just removed the 2 crown. Okay, then I will do 2 temporary crown. Okay, this is 2 temporary crown. Good, guys? That's okay? Okay. These 2 temporary crowns, they are same shape, same length, same dimension as the contralateral crowns. If you see this lateral, same length like this lateral. This central, same length like this central. All is the same shape, okay? We good? Then I told my lab, okay, these two crown, I need you to make to me two Emax crown with glazed and lingual surface, and please let the buccal surface non-glazed. I need it non-glazed, okay? Again, this is two crown. I will transform it to porcelain, Emax porcelain. Why Emax? Because Emax I can etch it, okay? So I will transfer this to temporary crown to Emax crown. At this point, I don't want him to do glaze to the buccal side because I will add veneer over the buccal side. Later on, you will see. So I need only to glaze the lingual side or palatal side because, okay, it's done, it's finished. I will not do anything in the palatal side, but I need the buccal side non-glazed, okay? So I have here two temporary crown, right? And I have the natural. Then I will do my composite mock-up over the two temporary crown and over the natural teeth. Then I will do good polishing and finishing. Okay, what I have here, I have two crown, temporary. Then I add composite, very minimum thickness over the two temporary crown and over the natural teeth. Okay, this is the mock-up for, yes, preplus veneer, to add preplus veneer over the crown and over the natural teeth. Okay, then I go to cement, two-step cement. First, I will cement the crowns, substructured crown, ceramic substructure. This crown, I'm just telling my technician to have it the same color or act as he can to match the color of the natural teeth. So the two substructure crown, they have to be good in size and shape and proportional like the natural teeth, and as much as I can near in color to the natural teeth. So at this point, I have no problem with veneer and crown. Why? Because I will add 4 veneer over the crown and over the natural teeth. So all the veneer will be added over tooth. All of the tooth is the same color. So I will not have the problem in the thickness of porcelain and thickness of crown, because all the veneers come same thickness, same translucent, same color. And the substructure, downward the veneer, all of them is the same color. So I will have no problem. So first I cemented the two veneer, the two crown. And of course, this crown is not glazed from the buccal side. Again, they are not glazed from the buccal side. Then after I do cementation for the veneer. Of course, when I do cementation for the veneer, this buccal side, these two teeth is porcelain. So when I do etch for these two teeth for cementation of veneer, the etch should be hydrofluoric acid because it's ceramic. This is two crown. So that I didn't do any glaze in these teeth. I leave it because I will do etch here over the crown substructure. This etch is hydrofluoric acid, and the etch for the other two teeth will be phosphoric acid because this is two natural teeth. Then I do my cementation for the veneer, and I cemented veneer over the natural teeth. I cemented veneer over the crowns, and this is the result. Okay, okay, guys. Listen, of course, it's many steps. Even it's challenging because it has time in cementation because I have cement the crown substructure first, then I have to cement the veneer. I have to use a different material over the natural tooth for cementation. I have to do different material over the porcelain for cementation. It's many steps, but let's see, is it less is more or not? Okay, let's focus. Here, the patient moved from good smile to better smile, right or not? Right, okay. This patient, when moved from good to right smile, what happened in the teeth? Nothing. Did you grind his teeth? No. What happened? I changed this to crown. And I put two preplus veneer here. So I didn't grind these tooth. I didn't grind these tooth. I just removed these two crowns. I didn't use my handpiece. This is less and more or not less and more. Okay, it's many steps, but the end, the patient will be yes, because what? Okay, I said from the beginning of the lecture, don't calculate money. Don't calculate like how much it's gonna cost, how much the patient is already willing to pay, okay? Of course, patient is willing to pay more and more because you didn't grind any of his teeth. You moved his smile from good to better without grinding any of his teeth. You just, what happened? You correct what happened from the dentist before. I just corrected. I corrected the two crown. He did it before. The two crown, he did it in another dentist. I'm just remove the crown and put new crowns. I put new shield over the teeth, 4 teeth, and I move. You changed the totally smile. So this is less is more. It's less workload, less preparation, or to be honest, in this case, it's zero preparation. It's non-invasive at all. I didn't do anything. Okay, and at the end, it's a very good result. Of course, we did bleaching to the whole arch. Okay, guys, do you want me to go on or that's it? You want to finish? It's up to you. I need to know, you want to go on in the lecture or that's it, that's good for tonight? Okay. Okay, guys, let's go on. Okay, now I'm gonna speak. Okay, انت كدentist كشمس, we are saying to us many things like less is more. We have to giving us some idea. You're doing ceramic substructure. You said we do evaluation for cases. We put midline line in the midline. We have to be mirror image between right side and left side of smile. It should be in harmony. All of this is good, but the problem, how I can solve problem if I have patient coming to my clinic and patient is come to my clinic and said, okay, doctor, I have a good smile. I want to move it to better smile. How can I think? How can I decide what I have to do? ايه steps? What is the situation? أعمل إيه قبل إيه? What? I don't know. I'm confused. وده اللي دايما أنا بقول لك عليه. I have many good dentists. I have many good dentists. They are very clever. They have good hand. They are skilled. Very handyman. They do very good preparations. They do veneer. They do crown, composite. Everything is good. But دايما عندهم مشكلة ان هم good phase او confused. لما بيجي البيشنت يقول لك I wanna improve my smile. Okay, no problem. هنا يبدأ يبقى confused. هو بيجي له panic. طيب اعمل ايه؟ شاف السمايل. Okay, how to improve this smile? How to make this smile look better? مش عارف. انا بعرف اعمل preparation. انا بعرف اعمل كل حاجة بس انا مش عارف اعمل ايه. ابدأ منين؟ This is the point. From where to start. This is our concept. هقول لك النهارده على جزء من دافنشي كونسبت فليفر بتاعه عشان تعرف تشتغل بيه. الفليفر بتاع دافنشي كونسبت how to start. يعني لو جالك اي clinic to your clinic and want to do a static case, how to start. تبدأ منين؟ How can I start to analyze? How can I start to do the treatment? اوكي. خلينا الاول نتفق على حاجه. لو انت عندك شايف البيكتشر اللي قدامك دي، اول حاجه عينك هتشوفها عشان تكوركت this picture الفريم. You have problem. دي اول حاجه الاي catch it. You have a problem in the frame. تاني حاجه you catch it تبدا تفكر فيها الصوره inside the picture inside the frame. but اول حاجه انت بتشوفها مين؟ الفريم ذات نفسه. الفريم ده بالنسبه لنا as a dentist resemble الجم soft tissue. So the first thing you have to correct in anything in the wall at first, the frame. Then you start to correct the picture. The picture بالنسبة لنا is a teeth. Okay, the picture is a teeth, and the frame is the gum. Is it accepted? Okay. So let's go to the concept. This is the concept. It's called games. Games. When you start to we deal with any kind of aesthetic treatments. We play games with the patient. We try to go step by step to see the problem and to try to solve the problem to have a good smile. Games because the gingival architecture, axial inclination, midline canting, embrasure, smile line, and shade. All this is called games. So when the patient comes to your clinic, gingival architecture. Okay. أول حاجة هنبص عليها gingival architecture. The patient is coming and said, okay, I need to improve my spine. We said ان احنا متفقين ان احنا بنشتغل على concept less is more. Less is more mean I will improve smile with less workload and less preparation. This is 80-90% result to the patient. If the patient needs more, I can do more, but I have to be more aggressive, like prep veneer or 0.3 or 0.5 millimeter veneer. Okay, guys. So here, what is the first thing in our concept games? Gingival architecture. The first thing in games. So I looked at the gingiva. Okay, when I looked at this patient, of course, we need to do some gingivoplasty. We need to do gingivectomy, blah, blah, blah. It's okay. You need to have, for any aesthetic dentistry, to be honest, you need to have some knowledge about perio, surgery, implant, aesthetic, fixed. Every field of dentistry, you have to know everything. So here, the first thing is, in this picture, I think, okay, first thing I see the frame. I look first to the gingiva. Okay, you need to do some gingivoplasty. I can do it by laser. Okay, this is done. The case is sold out. This is 80% smile, right? It's not 100%, but it's 80% smile. In our concept, less is more, I will be glad to tell you that the patient will be happy. I will never see this patient again. He will never come back to the 100% smile at this moment. Maybe 2 years later or 3 years later, he'll be motivated to do more in his teeth. But at this situation, he thinks you are magic. You did magic. Yeah, you are a magician. Because he comes to your clinic, it takes you like half an hour to do gingivoplasty, guys. With laser, half an hour. Half an hour, you change his smile completely from one situation to next situation, and the patient will be very, very, very happy, and it's done and sold out. Okay, let's say the patient come to your clinic and you look to the gingival architecture, the first one in games, and it's good. Then you look to the axial. Second thing you look at axial inclination. Okay, let's say what is axial inclination for people if you don't know. Axial inclination is the long axis. Long axis of tooth. When we go from anterior to posterior, the long axis of tooth is try to be drifted a little bit mesially. Okay, so here, this patient has come to my clinic. We look to the gingival architecture. Gingival architecture is good. Second thing, we look axial inclination. Axial inclination is not good. To be honest, guys, axial inclination, sometimes the best choice to correct axial inclination is to doing ortho treatment. Second option to treat axial inclination, or I always like, to be honest, if the axial inclination is problem to do ortho. Second, to start to think of something fixes, veneer, crown, blah, blah, blah. Sometimes if it's minimum problem in axial inclination and you can correct it by concept called illusion, contouring of natural teeth, it's good. Because you're doing this without anesthetic, patient finish all in one visit, and you just work in enamel. Okay, I know it somehow is going to be difficult for you, but I will let you see because it's a different situation. It needs up-level learning. We speak about it in many courses. It's called illusion, contouring natural teeth. Okay, here. This is what we do. This is my concept. This is,
and as you can see from the sequence I shared with you at the very last case, that can sell us plus.
Okay, this is my concept. This is how we do the case. Here, what happened? We just بدأنا نعمل contouring للnatural teeth according to occlusion. According to illusion, we start to change angulation, special angle in the tooth to change the orientation or to give you illusion of the axial inclination. التيث هنا ما فيش أي حاجة اتحطت في السنان. There is no artificial veneer, nothing. Just we did bleaching, and if you see here, we add a little bit composite in this area. But خلينا نبص عليها تاني. This is, you have here problem, fracture tooth, you have angulation, the angle here. contact between lateral and central. You have here buccal corridor is closed. Here you have problem in the, let's say, in the surface texture of the tooth. Closed embrasure. We did all this by grinding enamel. To be honest, guys, this is illusion and contouring natural teeth. Without it's no big deal. You work in enamel, okay? You can remove from enamel 0.2 millimeter or something. It's not big deal. You're just removing with hand piece, no problem. Patient will not feel anything. Even if you're afraid from sensitivity, there will be no sensitivity. Even if you still more worry, you can do 2 or 3 fluoride application to the patient to be sure there is no sensitivity. Then the canine. Okay, this is the case after we did the cosmetic contouring and we correct the smile. This is the 2 pictures together, before and after. This is called non-invasive procedure. We finish everything in 1 visit and we did bleaching, and the patient is more than happy with the result. It's 80% result, to be honest, guys. It's 80%. But as I said in my concept, I do 80% result to be less is more. Okay? But to be honest, sometimes the axial inclination is look like this. Dilation, this is the axial inclination. Every tooth is look everywhere. This is tooth look to the west, this look to the east. In this situation, I can do anything except, of course, I have to do grinding. I have no option. This is no option to correct this smile without grinding. I have to do also, or I have to do a little bit grinding and doing veneer. Okay? So this is, as I said, the concept is work with 90% of cases when they have good teeth and want to move to better teeth. But it's not working with I don't understand somebody write in chat puta. I don't understand puta, to be honest. Puta. Okay. So as I said, this concept work with teeth when the teeth is good. As I said, this concept is work with teeth when they have good teeth and they want to move to better teeth. But if you have the teeth like this, the axial inclination, at this situation, I told my patient, now we have to do design and I have to grind up your teeth. This is the only option. Okay? So we move in game. We have another patient. We check the gingival architecture is perfect. Axial inclination is perfect. So we start to look to the midline. I need you to put this phrase in your mind. The most important 20 square millimeter of any smile design located between midline and the mesiofacial line angle between the 2 central incisors. This is the most important area in any smile design. If you want to correct any smile design, you have to correct this area first. Why? As I said before, this is 1 central, 2 central, and midline. It's called the twin teeth. No, I didn't. Okay, هجاوب حاجة على الشات وبعدين طب ماشي هجاوبها وبعدين هخلي كل الانسر بعدين. How did you change the contour without preparation? أنا ما عملتش preparation. أنا عملت contour. Contour you have to use hand piece of course. I said I use my hand piece to doing حاجة اسمها illusion natural tooth contouring. I do contouring من natural teeth. يعني بشتغل على natural teeth as an natural teeth عبارة عن as you have عارف لما يبقى دكتور ميدو دكتور لما يبقى عندك مثلا like composite mock-up. When you have composite mock-up, you can use your hand piece to correct the angle, correct the direction of the composite mock-up. The same. I work with the hand piece over the natural teeth to correct the angle of the tooth. Okay? لما اخلص ممكن نتكلم في الاخر هاخد الاسئله وجاوبكم عليها كلها ما تخافوش انا موريش حاجه سهران معاكم كلنا محبوسين. Yes, selective grinding. برافو. هنا عندنا one tooth central and one tooth central وميد لاين. عندنا two central teeth بينهم ميد لاين. اوكي دول بنسميهم ال20 teeth. ليه 20 teeth؟ لان بنسميهم الويندو teeth. يعني any patient you look directly to any patient the first two teeth you see always is the two central teeth. Okay, وبينهم الميد لاين they are high comparison teeth. They are in very high comparison. They always compare the two teeth together. أي defect فيهم أو أي defect في الميد لاين any eye will catch this defect. Okay, so this is the first. أول حاجة you have a most important area you have to correct in any smile design. طيب لو أنا هنا جيت في السنترال دي وبدأت أعمل composite veneer. وانا بعمل الكومبوزيت veneer I did some mistake and I changed the angle الميزوفيشال angle. If you look now you have one mesofacial angle doesn't resemble this mesofacial angle. ده هيدي illusion ان في shift في الميد لاين. Okay, I said illusion ليه؟ لان هنا التو تيث ما حصلش فيهم movement, no movement في التو تيث. كل اللي حصل في التو تيث ان احنا adding ايه؟ adding composite بس، لكن ما فيش movement في التو تيث، ما فيش اي movement. المشكله اللي حصل اسمها optical or illusion shifting. Illusion shifting of the midline because this line angle is not resembling this line angle. So you have to correct this line angle again to have good. طيب خلينا نشوفها clinical. Clinical عندك حاجه كمان هنا. ده مين؟ ده مش هو الفنان ده توم كروز. هنا ده عندنا الدنتال ميد لاين وده الفيشال ميد لاين. Any case you have angle between the dental midline or facial midline, it should be corrected because it's catchy by the eye. You have to correct it. Okay. Okay. Here, the patient جالي. خلينا نتشيك مع بعض بقى to apply the concept one step by step. Okay. أول حاجة we look. Gingival architecture. The patient, our complaint of patient, he went to another dentist. The dentist عمل له smile makeover using composite, and the patient is not happy with the smile. Okay. طيب the patient is not happy, want to correct smile. أول حاجة هنطبق الدا فينشي concept how to solve most cosmetic cases. أول حاجة عندنا gingival architecture. I have a good look on gingival architecture. Okay, it's look good. Done. Axial inclination. Perfect. Done. Go to midline canting. No, it's not good. Did you see this problem? Okay, guys. هنا لو انت بصيت للكيس first look اول ما تبص للكيس the first look you see this because I told you this is the most important area for any smile design. بعد ما بتشوف الديفكت في الميد لاين you start to see defect the contouring of the teeth is not good. Okay, the contouring of the teeth, all the contouring of the teeth, it doesn't look good. لكن انت اول حاجه بتشوفها مين؟ بتشوف الميد لاين. To be honest guys, this case is very good for aesthetic for your cases because الكيس زي دي انا مش هعمل فيها حاجه. انت عارف انا هعمل ايه؟ انا هاخد a credit over you over the previous dentist. كل اللي انا هعمله ايه؟ I'm just going to contour this composite, doing finishing, polishing, and correct this. Done. Case is done. Just polishing, finishing, and contouring. I will not change the composite. I will not do anything. Just I'm correcting, contouring, correct the midline. If you see here, the midline here and here. Always دايما midline أول حاجة العين catch it. The first defect you catch it by your eye. Then you start to see the other defect, but the first catch is always here, the midline. So تاني حاجة عندنا في الكونسبت، تالت حاجة sorry midline catch. Okay. Embrasure. Embrasure دايما أنا بحب أسميها end business of dentistry. ليه ال end business of dentistry؟ To be honest guys ده اللي بندفع فيه فلوس. This is how we pay money. We pay money for lab to doing for us very natural looking teeth. Very natural looking teeth معناها ايه؟ ان التيث فيها embrasure look like natural teeth. لو اللاب باعت لك bridge with nice embrasure it look natural. لو اللاب باعت لك embrasure sorry bridge بس ما فيش مش فاتح الامبريشر it's closed the embrasure it looks fake ليه؟ لان it look like checkless teeth or box teeth doesn't look natural, so you have to open the embrasure. The embrasure between the teeth they don't have any geometrical shape. مالهمش shape متعارف عليه. It should be more wide when you go from anterior to posterior teeth. This is only the concept to go bigger with embrasure from central when you go to the posterior teeth. طيب لو هنا بصينا على case like this, if we go to gingival architecture good, axial inclination is good, midline canting no, everything is good, we go to the embrasure. Okay, we have closed the embrasure here between the two central, right? Okay, so The first option here, we have to correct this closed pressure. Of course, a closed pressure دي دول natural teeth حصلت ليه؟ Because attrition of the two central بدأ يبقى فيه closed pressure. So our option of treatment to open the pressure again. We open the pressure with a disc. Okay, I will let you see. I think in the end of the lecture we see how to open the pressure. We open the pressure with a metal disc and we correct the line angle on the tooth, and we don't do anything in the tooth. We don't. Maybe I do bleaching, but I don't do no other treatment, no veneer, nothing. Okay, so this is less is more. This is less workload. I evaluate the case, diagnose the case, I finish the case in one visit. This is less is more, guys. Okay, even here, look to this case. Forget the upper teeth, and I need you to focus on the lower teeth. If you focus on the lower teeth, now you will see some problem. You will see something is wrong. Something not look natural. There is something wrong in the lower teeth. What do you think now? It's more natural, right? Right. Why? Because here all the contact between the lower teeth, the pressure is closed. Here, I open the pressure again. Smile line and shape. This is the last one of our concept. Of course, we know the smile line mean that the upper teeth, upper maxillary teeth is going with a curve with the lower lip. Going with the lower lip is go like wing-like. This is smile line. And this is straight line. Straight smile line happening when the two central become the same length like canine because of attrition. And this is the reverse smile line. Reverse smile line is happen when the two central is short than the canines, and this is always due to bone defect or anterior maxillary defect. Okay, so in this case, if we see, we go gingival architecture, perfect. Axial inclination, not bad. Midline, good. Pressure is open, everything is good. Smile line, okay. Now I have a straight smile line. So I have to correct straight smile line. Straight smile line, we said we have a straight smile line because the two central is the same length or short than the canine. So to correct this, I have to lengthen the two central. So now the two central is the same. This is threadless veneer, guys. You see the material even, if you have a look in the two picture, you will see this is the porcelain here is over the teeth. The smile is become more prouder, it's more bigger smile. This is prepless. We add ceramic. We didn't remove anything from the teeth. So now I correct the smile. Once I correct the smile line, I correct the whole smile. Okay. Okay. Last thing, this case, if we see gingival architecture good, axial inclination is good. We go to midline is good. Midline, to be honest, is not so good. It's a little bit here. This tooth is tilted over this tooth, but we will say it's good. Pressure, okay. Smile line, good. So the last thing we have is shade. So we go from doing bleaching. Okay, the patient will be happy. We solved the case. Okay, now let's be conclusion. Games mean gingival architecture. First thing you look about, then you move to axial inclination, then you move to midline. You move to pressure, you move to smile line and shape. Okay, guys, believe me, if you do this concept in any patient and you move from up to down in every case, and all you did, and you didn't find problem in gingival architecture, didn't find any problem in axial inclination, in midline cantic and pressure, and smile line or shape, so please don't do the case. Dismiss the case. Do you know why? I will tell you why. I will dismiss the case because of two things. There is nothing wrong with the smile. I review that gingival is good, axial is good, midline is good, pressure is good, smile line and shade, everything is good. That means I can't see the problem, so I can't solve it. There is nothing, everything is good. Maybe sometimes you have an aesthetic clinic obsessed patient. Patient psychological unstable. They have a good smile and they obsess with better smile. and you can't do anything. Everything is right. So what I cannot do? Even the shade is good. If you see, we move it from the difficult situation, the soft tissue, until we go to the shade, the least procedure in aesthetic dentistry. So if all this procedure is good, so you don't do have things. And I believe me guys, if you correct this in any kind of smile, you will have better smile. Okay, this is how to solve and how to orient and organize your treatment plan and how to decide what to do in the patient. Of course, you need the skills. You know, you can attend one of my courses or in any other courses to learn how to do the bleaching, blah, 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 how to do all these steps. But this is how to orient and how to organize your brain to start to solve most cosmetic cases. Okay, guys. Okay, we have, I think, more 20 minutes. Okay, I need to know something from you guys. Do you want to go on or that's it? We have more 20 minutes to the end of the lecture. You want to go on or you want to? No, I'm not tired. I'm good. I have nothing. People attend my courses, they know I speak like 20 hours. I'm good. If you want to go, I go. Okay. So how many people we have in chat? Okay. Okay, I will do this. Okay, let's go now for one interesting subject for all of you. To prep or not to prep? To do prepless veneer or not to do prepless veneer? When I have to do prepless veneer and to do preparation or not to do preparation? This is 1 million question, guys. Always you ask. I go for prepless veneer or to prep veneer. Okay. Okay. This is prepless veneer and veneer is need too much training, not for what to do, because what to do, you don't do anything in prepless veneer actually, except what's up, to be honest. But it's need training to choose the case. Is case is acceptable for prepless veneer or not? Okay. What I'm going to say now is going to be more advanced. Okay. So I'm sorry, guys, again, for fresh graduate people, you will feel it's more difficult because this is going to be more advanced. Now, we found 5 foundation points for prepless veneer. 5 foundation points. This is the first point. You will surprise how many patients can be happy with, and you can correct the smile with adding veneer without removing anything from the tooth. It's not necessary to prepare margin to have good optical non-detectable margin. Most patients feel there is big difference between minimal prep veneer and between prepless veneer. Custom composite prototype is very important in determining the case for prepless veneer. Color shift is very important to determine with prepless veneer. I will go with these 5 points to explain it. Okay. The first point, or before the first point, I would like to tell you something, guys. Let's accept this. Sorry, what happened? For any case, guys, we have only 2 options. For any case, you have 2 options, okay? To correct any smile. To add ceramic over the teeth, so let's say we augment the teeth, we do augmentation for the tooth, so we make the tooth more thickness and we take the tooth to the buccal side or protrude it a little bit. وعندنا option تاني to correct the smile. يعني ايه correct the smile؟ ان احنا to remove from the tooth. يعني ايه to remove from the tooth? To do reduction. To remove surface from the tooth. To do reduction. والreduction اللي احنا بنعمله to reduct from the tooth surface. Then we add porcelain to have a good alignment of teeth. طيب خلينا to explain simply. If we have this arch of teeth, okay, in any smile, any smile curve, we have 1, 2, 3, this is teeth. If we draw curve line from premolar to premolar, and any of this curve line go over the teeth, all the teeth should touch this curve line to be in good alignment and look in the same alignment and go with the arch of the smile, okay? Anything goes behind this line should be removed. Anything under this line should be augmented or added to be touched the line. So let's go for this teeth. This teeth is look rotated, right? Here. To correct this teeth, we have to remove this piece, okay? If we remove this piece from here, because it's over the line. And if you look here, we have to augment it this ear. So if I put veneer here, this area is gonna be prepared. I have to remove it. And this area is going to be prepless because I have to add ceramic without removing anything of the tooth because I need to augment the tooth. I need to make the tooth more broader, more thick here in this area to touch the line. So this give you illusion that the tooth is rotated without doing anything. If we go to this teeth, look here. There is a space, very well spaced. So I can add porcelain piece, composite, whatever kind of material you're gonna use it for augmentation over the tooth without any kind of preparation because I need to add size. I don't need to remove, I have to add, so I can go prepless here. So this is the case. This is the tooth, this is prepless veneer. And this is the tooth after I reduct this area and added veneer. And here prepless veneer, so I give illusion and this tooth is corrected. So we found that many teeth or many smile will be happy to enhance it with adding like this ceramic without removing from the teeth. Ideal case for prepless veneer. There is many cases can be happy to use prepless veneer and it's nice. Let's go case by case. The first cases is premolar extraction for ortho treatment. Okay, these cases is always when you do extract premolar and do ortho treatment, maybe 1 year, 2 years later, the patient doesn't use retainer, blah, 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 some relapse happened. Here, we always have spaces. The spaces mean it's good. The tooth in good alignment because of the ortho, of course, but they have spaces between the teeth. The spaces mean I can put prepless veneer here between the teeth without any kind of preparation. So it's easy to do prepless veneer here. Second thing is short word teeth. Teeth that is attrition by age or whatever, and they lose the length. You can lengthen this teeth without any kind of preparation. With respect, of course, to occlusion. To be honest, respect of occlusion and anything you do in your teeth, you have to respect the occlusion. Big lateral. I have to tell you something in big lateral. Please promise me, guys. Never, ever prepare big lateral. Don't prepare. It's already prepared by nature. Don't touch the big lateral. The tooth is already prepared by nature. Just take impression and put veneers or crown or whatever. But please don't prepare big lateral. The tooth is already prepared by nature. If you look in this case, this big lateral, what we did is one veneer, even we didn't touch the two central. Okay? The two central, we did only bleaching on the two arch, of course. Just we did veneer on this prepless veneer on the lateral. Lingual position teeth. If you look here, this teeth is lingually positioned, right? And I need to move this teeth more buckling. So I don't need to grind. I just need to put porcelain to make the teeth more protruded. So it's prepless veneer. I didn't do anything in two central. It just to straighten up and make the two lateral teeth to go more buckly. Omar asked, there is no finish line for big lateral. My friend, you will just wait. We don't do any finish line in prepless veneer. No finish line at all. Teeth, big lip. Okay, big lip, this is, let's say, big lip or small teeth. Some people, when you extract the teeth like this, you will see the teeth look very nice. no problem. The smile is good. But if you put the teeth in comparison with the lip and the whole face, you will facing that the teeth is looking small than the other teeth. The teeth will look small in comparison to the lip and the face. The problem today, even today, that the people may be born with big lips, or maybe they buy it. You can buy now big lips. You can do filler or whatever, so you can have a big lip. So when you have big lips, the teeth is looking always smaller. So you need to augment these teeth. You make this teeth bigger to go on with the big lip and the big feature of the face. Of course, as you said, you want to make the teeth bigger. So you need to add porcelain. So you don't need to do preparation. You need to add porcelain. So you add porcelain over the natural teeth to have it look like more bigger. It's totally privileged. Buccal corridor, of course, if you have a buccal corridor, the most way just to add porcelain to close the buccal corridor completely and have a good, perfect smile. For space teeth, the same like orthodontic extracted teeth, premolar, you have the isthma between teeth. It's the best situation to do preplate veneer. Okay, so second point is, this is Omar, this is the point you asked about. Is it necessary to prepare natural teeth and do finish line to have good non-optical detectable margin? No. I will say to you, in preplate veneer, we don't do any kind of preparation and tools. We don't do finish line. We just ask our lab to stop the veneers at the gingival margin. Because we don't do any preparation of the tools, we don't do any kind of finish line, so we need to have good term, because we don't do like chamfer, we don't do shoulder finish line. So our new term is called the infinity margin. That we don't do any margin. We just stop around them, around the gingival margin. Okay, advantage of the infinity margin, to be honest, guys, it's most undetectable margin optically. You can detect, sorry, I will go back. Most undetectable optical margin. You can't see anywhere by your eyes. The second thing is the reveal of this margin exceed any margin, even you can detect with explorer. Most favorable margin for when the cases age and recession happen, this is the best margin, because there will be no line of demarcation at all. Allow for future graft. If you want to do grafting for the gingiva, you can do grafting as long as there is no preparation, there is nothing touch the tooth. Allow for reversible treatment. If you want to do reversible treatment, you can remove the veneers. Okay, no problem. There is no preparation, no finish line, so the veneer can be removed. There is no problem. Okay, but there is nothing come in your life without disadvantage. Any package you have in your life, it has advantage and disadvantage. The disadvantage of infinity margin, it's require intraoral finishing. You have to do finishing for the finish line inside patient mouth. I will speak about this later, maybe in 5 minutes. Very difficult to do this if the case, the margin should be subgingiva. If the margin subgingiva, this is not the margin for choice to use it. Underlying tooth color should be good, because if the tooth color is darker tooth color or the tooth color is not proper, it's somehow it's very difficult to use the infinity margin. The last problem, the margin is very difficult to develop in the lab, because it's going to be thin margin. It takes time with the ceramics to develop. Finishing on infinity margin. Okay, let's speak about it. Okay, to do cement finishing to the infinity margin, as we said, we ask our lab to stop on the pregingival margin. He will stop on the pregingival margin. Of course, when he stops at the pregingival margin, the porcelain thickness at the pregingival margin is thick a little bit. I mean by thick is maybe it's 0.3 millimeters. So it's still thick and detachable by probe and detectable. If you move your probe, you will detect it, and it's gonna be step like step. So we have to finish this intraoral. When we finish it, after we cemented the veneer. So I cemented the veneer. Then after I cemented the veneer, we just use mosquito diamond bear to do bevel 45 degree at the porcelain level at the margin to make it like bevel and non-detectable. Okay, then we open, if we need to open the embrasure, this is how we open the embrasure, guys. I hope with metal disc. Then I go between teeth with metal strip to open the contact. Then I go again between teeth with strips, sandblast strips to have a smoother contact between the teeth. Then we use carbide pair again over the margin for 5 degrees to make it more smooth and non-detectable. Then we use carbide impregnated diamond. Then we use rubber cups to smooth the porcelain. Okay, now you have the porcelain already finished and non-detectable and nice. Okay, but we have a problem. This is, we need to glaze, right? We touch our porcelain with diamond, with carbide, and we need to glaze this part again, right? The problem is you can't take it back and send it to the lab to glaze because you already cemented the veneer. So you have to do the glaze as the lab work, do it as we do it on the lab, we do it inside patient mouths. It's easy, guys. They do glaze for Emax or filled spasic. It's very easy to do it intraorally because we can use the same equipment we use it in the lab. We need just to brush, different kind of brushes, and we need paste like aluminum, diamond paste, diamond paste to use it, and we need different brushes to use it intraorally because this is the same we use in the lab. The problem here is one problem. In lab, and inside patient mouth, you have to manage soft tissue and you have to manage heat because this kind of brushes, they generate too much heat. But in lab, there is no problem for heat or soft tissue. There is no soft tissue and the heat is no problem. So if we do this inside patient mouth, we have to add some liquid or whatever to protect the gum. And at the same time, we have to blow air. If you see here in figure 11, we blow air to manage the heat. Then we go to do, if you see, it's completely glazed. And this is the result at the end. So infinity margin, according to minimal prep margin or minimal prep veneer or shallow chamfer finish line. To be honest, guys, this is the difference. I'm sorry about this picture for infinity margin. I know the picture is not good, but I'm not good in photography, to be honest. But if you see, if you look deep, there is no big difference. This is the margin. Do you see any problem in the margin here or here? No. This is good margin. This is prep chamfer line margin, and this is prepless margin. The gum is good. The gum is healthy. Nothing, no inflammation, non-detectable margin, and the vision is very good. Okay, again, let's look. Sorry. It's forced to be done. This is 2 weeks later. If you have a look, the margin is perfect. No problem. And the most important thing, it's reversible. I didn't touch the tooth. It's reversible. If I want to move this, I can take it out. The tooth is going back to the same like this. So it's very detectable margin, undetectable margin. Color shift. This is a problem with prepless veneer. Actually, it's problem and not problem. Let's explain. It's a problem. If the tooth is very bad in color, okay, and we use prepless veneer. When we use prepless veneer, we use the veneer is thickness is maximum 0.3 millimeters. So 0.3 millimeter, the veneer is very translucent, okay? So if you have tooth with like this with very bad color and you add the veneer prepless over it, okay, you can't. Why? Because it will take the color of the tooth so it doesn't look nice. So you can't use prepless veneer if the teeth is very darker or the teeth is, the color of the teeth is not appropriate, okay? Second advantage of veneer according to the tooth color again. Okay, guys, listen to that. When we do drilling in any enamel, what happened to the color? It's become more bright or it's become more darker? Of course, it's become more darker, right? So if we do any preparation on any veneer and any enamel, the tooth become more darker. So that sometimes when you do preparation for any teeth, the color become more dark. So it's better to add, sometimes it's better to add prepless veneer over the tooth. It gives you better color than to prep the teeth, because if you prep the teeth now, the color of the tooth has become darker. So you need to add more porcelain to remove the discoloration. I'll mask the discoloration. So in this case, you will end with bulky restoration. The veneer will be bulky. Or you have another option to grind more for the tooth to remove more from the enamel, so the thickness of the veneer will not be bulky, but at the same time you become more invasive and you remove more. The last thing, most patients feel strong there is difference between prep or non-prep veneer. Actually, yes. The people think there is big difference. Advantage of preparation veneer. Okay, listen guys, I'm not against prep veneer. No, I doing prep veneer in some cases. Some cases can I do prep veneer? Some cases I can go, as long as I can go prepless, I will go prepless. If I can't, I will do prep veneer. I'm not against prep veneer. Actually, prep veneer has a great advantage. Allow excellent contouring, of course, because it's uniform. You remove from the tooth, so you will have good contouring, especially in cases you can't add volume to the teeth. You need to have the teeth in the same volume, so you have to remove from the teeth to add porcelain the same volume you removed, so you don't have exceed volume of the teeth. Make the fabrication easy in the lab. When you remove, you do preparation. Make the temporary is thickness and easy than prepless veneer. Allow easy temporization, and allow the color is going to be very nice uniform color from up to down because the thickness of the porcelain. But as I said, ما فيش حاجه دايما باكج كامله، دايما الباكج بتيجي بادفانتج و disadvantage of prepping. Sorry. Oops. Okay, the disadvantage of prepping. Generally make teeth darker and can be challenged to mask, especially when bleach color range are desired. دي النقطة اللي أنا اتكلمت عليها قبل كده. We speak before. أنك أنت when you grind from the enamel become more thin and the tooth become more dark. So you have two options to increase the thickness of porcelain, so you end up with bulky veneer, or you have the choice to remove more from the tooth, not to have bulky veneer and you become more invasive. Disadvantage of prepping 0.3, 0.5 prepping disadvantage, you may eliminate enamel in some area. I will speak later on this, especially cervical area. Of course, as long as you remove from the tooth, it's not reversible. And many patients, as we said, will not allow you to remove from the tooth. Average thickness of enamel always in cervical area is 0.6, sorry guys. It's 0.6 in the cervical area. So it's very challenging to do shallow chamfer. So you have to remove 0.3 to 0.5 millimeter only. So it's very challenging to remove parts of enamel and leave. Sometimes it ends with you and you remove all the enamel into cervical area and your finish line in dentine. The problem if your finish line in dentine here, you will have leakage, and next thing you will have the dentine shine under the restoration, and the restoration itself, the optical properties will be changed than the other veneer on the tooth. Negative effect of removing enamel from the tooth, to be guys to say it's potential happening. It's not happening in all cases, to be honest. Some cases, but some cases we see that you will, if you read this, you will feel yes. I see some cases when you remove from the enamel, the people is high sensitive, they go for end of treatment later on. Some people when you remove the enamel, potentially some happen decrease strength of the tooth and the tooth is fracture later on, or debonding of veneer, potential for more pain and post-operative sensitivity, potential for tooth discoloration, as we said, from removing the enamel, potential for margin to be indentine, potential to margin to be more visible and detectable, potential for trauma for the patient when he sees his teeth grind. So if we look to this picture, guys, this picture, all of us, if we look to this, we will say, okay, it's perfect teeth. I love this teeth. This teeth look very beautiful. When we see this picture in magazine, we said, this is one of the best teeth I have ever seen. This is good preparation, guys. This is very nice. This is gold standard preparation for minimal prevention. And all of us as a dentist, we have to say that this is perfect, to be honest. But the problem is our patient, when see this preparation, they will say the same. They don't understand. They're gonna say the same. It's permanent, it's painful, gross, and we'll say no. So please, people, we need to grow up as a dentist. I said to you, it's a new level of education. It's advanced. We need to grow up. We need to listen to people who are served. We need to listen to our patient. Our patient nowadays, they want to go with less is more. They need everything without preparation. Okay, this is very important part in when you are deciding to go with prepless veneer. Okay, this is called composite prototype. And composite prototype, this is very important. Why? This is case, okay, I'm decided I will go with prepless veneer. When I do this case with prepless veneer, that means I will add more volume of porcelain over this piece. So I have to try this first on composite. So I build up composite over this piece, and artistically I contour this composite over the piece. So I have the idea, if I add volume over this piece, it will look nice and acceptable, and the patient will accept it. Or it will look like very big teeth or protruded teeth, and patient will not accept. So this is very important step in determine if I can do it or not. So advantage of composite prototype, it provides the patient with a new smile. We do it directly inside the patient mouth, and patient have this drive option for maybe 1 week, 2 weeks. He can try the smile. If he accepted, okay, accepted the new volume, the new lens and everything, okay, so we can do this in ceramic and put it just prepless, cemented over the tooth, and nothing else happened. Allow dentists to artistically, you can carving and do everything inside the patient mouth, and then you do the porcelain veneer the same like what you did for your composite prototype. Allow much thinner temporary, and material is more quality because composite is more quality than other temporary material. Give you information about the shade, because the shade of the composite can be compared to the shade of the porcelain. Allow for definite decision in borderline case. So give you decision, okay, the tooth, when I add volume over this piece, it look good or not? This is the borderline case. The case you're afraid it's gonna be look very bad. So how to do it? It's easy, guys. You're just doing etching, spot etching. Focus with me. You do spot etching in the middle of the tooth. You don't do total surface etch. You don't do total buccal surface etch. If you did total buccal surface etch, it'd be very difficult to remove the composite prototype. But for these cases, we do only spot etch. After we do the spot etch, for people who attend my lecture or my cosmetic, anterior composite concept, the bench concept, they know our concept. We use the ball technique for composite. We take composite and make it a ball. Then we start to put ball in every tooth, and we start to carve every tooth alone to have the good smile we need. Then we do polishing and finishing for the smile, and this is gonna be our composite prototype. Then the patient go with this smile for 2 weeks. They try the smile, try the new volume, try the new adding composite over the teeth, the thickness of the teeth, the length of the teeth. Then come back after 2 weeks. If he say, okay, I like it, then we move it and we do it in veneer. At the end, I'm always saying, finding your way in any dental journey is gonna be simple if you planned in advance. So composite prototype you have to start with. It's very important. I like to have it in the end of our lecture always, because to remember you have to start with it, because it's borderline and give you the idea if you can do or not to do. And thank you guys انكم استحملتوني وقعدتوا معايا to the end of the lecture. I know it's 2-hour lecture, it's big lecture, but I believe it's interesting, and most of people will feel that happened with me in my clinic. Most people saying no, and it's new technique. I hope you like it, and I hope everything was good. And now we can have questions. If you need any question, you can ask, and we have 5 minutes to answer all the questions. Thank you guys again. Does prepless veneer has the same durability? Yes. Any veneer, as long as you cement it very well to the tooth, it will have the strength of the enamel. So don't worry, all of the same. They're gonna live the same. So don't worry about, again. Veneer veneer is you buy it from company. It's not veneer to you learn it. You just buy it. You have to spend some money to buy from company, and I don't recommend it. This is a prepless veneer retentive enough. Any veneer, believe me, my friend, Yusuf, any veneer retentive is the same. All is the same retentive. All veneer is depend on chemical retentive. Even prepless or minimum prep, they all depend on chemical cementation. They don't depend on any kind of mechanical, even prep veneer. Okay, so the cementation for the two veneers, or of course prepless or prep veneer, is the same. So all of them have the same quality of cementation. Who we maintain vertical dimension in veneer or crown? Dr. Ahmed, can you explain again? It's a good question, but I don't know if you mean what I mean or not. So can you explain what you need again? Who we maintain vertical dimension in veneer or crown? You mean تقصد نعتمد على مين في الفيرتيكال دايمنشن، veneer ولا crown؟ بص، okay, listen guys. If you're gonna do veneer and upper teeth, there is no problem with the vertical dimension. Why? Because veneer always in the upper maxillary teeth, the upper maxillary teeth in normal occlusion overlap lower anterior teeth, of course. So there is no problem in vertical dimension. The problem in vertical dimension is come with the lower teeth. If you are going to do prepless veneer for lower anterior teeth, you have to raise up the vertical dimension. Okay, why? Because the lower veneer, the lower anterior teeth is already touched and contact the upper maxillary teeth from the palatal side. Okay, so and if you want to add some volume over without touching the tooth, so you have to raise the vertical dimension. How to raise the vertical dimension? Thanks for composite or porcelain hats. We add more porcelain hats on the occlusal surface on the posterior teeth, so we raise the vertical dimension. Opaque cement will help. Okay, let me take the first. There's one question before augmenting dimension. I mean after preparation, we always depend on vertical dimension on posterior teeth, my friend. Even crown, anything, we always should have vertical stop. What your opinion about what? What your opinion about occlusal adjustment with non-prep veneer? I just answered this. Their opaque cement will be helpful to mask the tooth. Okay, listen, my friend. I don't recommend you at all to depend on cementation for opacity, for one reason, especially on the cervical area. Why? Because the color of the porcelain عمره ما هيتغير. It's fixed. Okay? But the cement, لو حصل leakage, especially on the cervical area or any leakage between the veneer and between the cement, اللي هيحصل أنا هيبدأ يحصل discoloration of the cement. The discoloration of the cement will discolorate the porcelain. لأن البورسلين is translucent. سو انا بحب دايما تعتمد على الاوباسيتي بتاعتك من البورسلين عن انك تعتمد عنها من الاوباسيتي بتاعت السيمنت except in one step. If you are sure 100% انك انت you don't have any kind of open margin or ممكن يحصل leakage, if you sure 100% you can use opacity. Don't worry. Does prepless veneer have bad effect on gingiva as it will be overhanging? لا, هنا اللي بيسأل السؤال مين؟ محمد. If you attend the lecture, you will see that there is no overhang. There is no overhanging at all عند الجنجفة. ليه؟ لأن أنا بعد ما حطيت البريبلس فينير I did finishing to the pre-gingival margin of veneer. عملت preparation للبورسلين margin, فما كانش عندي أي overhanging compared with natural teeth. بالعكس ده أنا قلت لك it's very difficult بعد ما تعمل له finishing للمارجن بانفينيتي مارجن بتاعتك, it never can be detected even by probe. لا, patient have grinding teeth, it's not acceptable to do even prepless or veneer. Both is not right to do veneer for any kind of this patient. If they have any occlusal problem, I don't recommend it to use veneer. It's better to use crown, and you first use posterior crown to protect the posterior teeth, then you go to anterior teeth. But I don't recommend any kind of veneer. Okay, guys. I hope you like it. I hope to see you more and more lecture. And I hope to see you in different lecture or on one of my courses. Thank you for your attending. Thank you for your patience to attend the 2-hour lecture. Thank you, guys. Goodbye.